Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Ronda Lewis from the Wicomico County Department of Social Services. You are the Adult Services Supervisor and you're a licensed and certified social worker, and you are here to talk about an exciting project. It's not that new, but you want to get the word out. It's called Project Home.
Yes.
So what is Project Home?
Project Home is it's a state licensed project, which basically is for adult foster care homes. So a lot of people know about foster homes for children, but this is for adults, anyone 18 or older who are unable to live in the community because they need extra supervision. They're just not able to maintain with their activities of daily living on their own. This is a program set up for them to be able to still live in the least restrictive environment in the community with the oversight that they need.
Now I know it's also called Project Care, Certified Adult Residential Environment.
Yes.
Are the majority of your participants older adults, or do you have them across the spectrum?
Here in Wicomico, we actually have them across the spectrum. I think the youngest one we've had since I started working with the program over 10 years ago was 18. And she came into the program at 18 and she's still with us.
Well, I guess I'm like interested in the older adult portion of it because it's a great way to keep seniors that need some assistance in the community, which is a great thing.
And a lot of the seniors that are in there, most of them are widowed or they've never been married, so they're just getting up there in age on their own. They're just, kind of starting to maybe see that dementia component where they're forgetting to take their meds or they're not comfortable driving anymore, getting themselves to and from the doctor's appointments. They've really started to isolate themselves and just not being able to do that daily care, like getting their bath, cooking for themselves, healthy meals. So this program allows those individuals that don't meet nursing home care or the level of care to be actually in a nursing home to be able to still be in the community. They typically will go to a day program during the day, so we get those individuals involved in like MAC or the adult medical daycares. They attend those during the day. The providers make sure they get to all of their medical appointments. The providers help them with personal care if needed. If not, they're perfectly able to do all that on their own, but they do make sure that they get that medication management.
And meals, is that expected that, usually you need to cook the meals?
Yep, the provider will provide them with all of their meals, all of their laundry, making sure their laundry's done, transportation to and from doctor's appointments, but also social activities in the community.
Are many of the providers retired people who are home anyway, or can some of them work, or it can be younger people that actually have to work? Or
we have a combination of both. Some of our providers are retired. And have been. Some of them, this is a second career for them. And then we do still have the ones that work during the day. With the working during the day and all of our providers, they're required to have a backup provider, at least two. So that is someone that has also been through the process of the background checks, the educational components that's required to be a provider. So if that person is working, their backup is expected to be there with the residents.
Well, speaking of requirements, let's talk about what the eligibility requirements are to be a provider. Let's start with the provider.
They have to be 18 and a U.S. citizen. They will be background checked. And we also do the social services background check where we also look to make sure that they've not been involved in any adult abuse cases or child welfare cases on that matter. They have to have CPR and first aid. And then there are continuing education credits that they have to take every year that we actually provide through the department. Their house, whether they rent or own, has to be inspected by the health department. And then there are certain things that we require within the home, like the resident has their own personal space.
So each resident has to have their own bedroom?
They can share if they choose to with like one other person if the room is large enough. But we also make sure that there's a place for medication to be locked up, chemicals are locked up, that there's, like no holes in the screens and things of that nature.
How long has this program been going on?
It has been going on, I can't even tell you, a long time. It's been going on throughout the
I've heard of it. I'm like just surprised. It's a great idea.
I honestly don't know, but I know it's been going on for quite a long time because our oldest provider here in Wicomico has been doing it for like 25 plus years.
And some people have several residents living with them because they have a home large enough that meets all the requirements.
And it's really up to them. Back when Project Home, probably 10 years ago or so, we were actually under a different umbrella. We were under more of the nursing side. We were under assisted living regs. Well, when that changed, they actually now will only allow 4 residents in the home. But if a provider says, I really only want 1 or 2, that's perfectly fine.
Too. I mean, it sounds to me it'd be a great opportunity for someone that's retired because they do get reimbursement to take care of that person. We'll get to that in a minute. And, especially nurses or people with a healthcare background that are more comfortable doing certain things.
Right. And it's not a lot of nursing care because every home actually has a licensed nurse assigned to them.
Oh, okay.
So that nurse does all the initial assessments on the residents. And then if a resident is hospitalized for something or there's a medical change, that nurse comes in and reassesses to make sure that the resident is still okay to be in Project Home. And then the nurse does quarterly visits.
Well, that's good. That's good to know.
And they're on call where the providers can call their nurse at any time if something is, medically wrong or they just want to run something by them.
Now, is there some sort of matching process to make sure you get along with the prospective resident that will be moving into your home?
Yes. What we do is once we start screening the resident, we get the medical background from them, from their doctors. They have to have like a TB test. We get a list of all their medications. We go out and meet with the resident that's potentially coming in, and we will talk to them to see what their likes, dislikes are, if they like to go to church, if they don't, if they want a particular race of a family to live with, just kind of get a feel for them. And then we, as a team back at Social Services, we sit down and talk to determine what provider we think would be the best fit and also the residents in the home. And then at that point, we make the phone call to the provider and say, this is who we have. Is this someone you're interested in or not? If they agree, then we actually set up a meeting in the provider's home. And then we will also do sometimes respite, where if the clients are a little hesitant about becoming a resident and, leaving their community, leaving their house, we'll do like a respite, like a weekend trial period for them to go see if it is really where they want to be.
Sure, it sounds very reasonable. Great idea. Let's move on to the eligibility requirements for the resident themselves.
Okay. They have to be 18 or older. Again, it is income based because with the Project Home, they are funded through public assistance to adults. So we do look at their assets. Currently, the medical component that is one of the biggest ones that's a challenge for us in Project Home is if they're not able to ambulate, because our providers are not able to lift on them. So they have to be able to ambulate. They have to be able to at least recognize their medications, because they're supposed to be able to self-medicate with cueing and coaching. Okay. And then really, as long as they're willing to go, they can go into Project Home.
And do they have to be interested or willing to do the community-based activities during the day, say at MAC or whatnot?
We prefer they do, and a lot of our providers will require them to, because it gives the providers the opportunity to take another resident to the doctor. Some providers, depending on situation, may waive that, and say, no, it's really okay if that person stays here. I understand. But typically we do like them to be involved in some type of activity in the community for the socialization aspect.
Well, that makes sense that they have to be able to walk. Now, I imagine in some cases they age in place and may no longer be able to walk, and then there is a case manager, you say, that oversees things.
Yes.
And will determine if the situation may not be working out anymore. And tell us a little bit about the case manager.
The case manager is through the Department of Social Services. They case manage the home as a whole. And then there's a case manager for every resident in the home. So the case manager is required to make at least monthly contact with the resident, whether that is at the day program or at the home. We really try to do both, because if something is going on in the home, the resident may not feel comfortable to tell you that at home. But the case manager works very closely with the resident, the provider, and the nurse consultant.
Now, are they face-to-face visits, or can
yes.
they be over the phone?
Nope, all of our visits
All
are done
face-to-face.
face-to-face.
I guess that's good. Look at them and make sure they
Yes.
seem to be doing okay.
And we do, just like with all of our programs, we will occasionally do an unannounced visit, just because they're providers. We have wonderful providers, but we will just pop in occasionally just to make sure things are what they say they are.
Well, I imagine you need more providers. You probably have plenty of residents interested or
Yes.
needing this type of situation. So what is the incentive for a provider? What are some of the benefits for them? And I guess start with, they do get reimbursed for this
Yes.
service they're providing.
There is a reimbursement through the state. It's based on the level of care of the client. We have levels A through D. Most of the residents that are in Project Home are level C or D, so it is a higher stipend reimbursement. They get reimbursed monthly through the Department of Social Services. It's where their payment is through the PAA program. But I mean, besides the stipend, they get the socialization as well, and they get to help the community members and residents right here in the community to help allow our elderly to age in place.
Yeah, it sounds very fulfilling if you don't mind having someone move in with you. But I imagine, are some of the people that are doing this widowed or retired, and
Most of
it's a
them,
companionship thing and feeling like they're doing a service?
some of them are actually still married. Their husbands are in the home with them. Some are widowed, some are retired. But I mean, it's a very long spectrum of who we have. But they just like that extra, I guess, companionship and being able to help.
Well, it sounds like a win-win, certainly, for a resident who's not quite ready to go to a nursing home or wouldn't be able to afford it. And obviously it's need-based, because people that have assets could just pay someone to come in and assist them with activities and such. So where can people get more information about this?
They can contact the Department of Social Services, actually any Department of Social Services, whether it's, here on the shore, Wicomico, Worcester, or Somerset. And there's the Tri-County recruitment line that they can call. It's 410-713-3959. And the recruiter that does that also does the foster care for children, but she's very aware of Project Home, and since it's Tri-County, we just have her call.
So people can call if they're interested in if they think they meet the requirements of a resident, and if they're interested in being a provider.
Yes.
They can all call that same number to get more information about Project Home.
Yes. And then they will be routed to make sure they're in the correct county, and we will get out with them to get all the information and start that process.
And you do have this nice little promotional piece.
Yes.
That you designed, I believe, that
We
gives
did.
the people all the information they need about, eligibility for each role and how the provider's reimbursed and such. So it looks like an excellent program.
It is.
It meets a major need in the community.
It really does, because a lot of the residents that we see, they don't meet the level of care for nursing home. They don't have the income to go to an assisted living or hire someone to come in. Or if they're on the intellectual, disabled functioning capacity, they don't meet the requirements for residential through like Department of DDA. So it kind of,
yeah.
so it makes that gap. I mean, Project Home is the gap filler for those residents in the county.
Especially with our aging population.
Yes.
We're not going to have enough nursing home space for everyone. And of course, it's where we can, and it's better to keep them in the home, in the community environment.
And the one good thing about Project Home is, even though, I mean, there's lots of good things, but one good thing is people always think, oh, well, I'm going to go live with someone. I still can't go here with my family or with my church because they go to a different church. That's not the case. Family can come pick them up and take them with them for vacation, weekends, holidays, whatever they want. Same way if they have a particular church group or activity, cards with their friends or whatever, all of that can still be done. It's not that restrictive. It is 24-hour care and supervision. And even if the provider has to run to the store to get a gallon of milk, they either have to take all the residents with them or have one of their approved backups to be there.
What about the family? Can they be a backup? Say the provider has a vacation planned or something. They can arrange for someone else to come, or the family can take them?
The family can take the resident, or their backup would be the one to provide the care with them. The resident's family, of course, don't have to be background checked, but whoever the provider is planning to allow to stay with the residents in their absence, or if it's somebody who's a frequent presence in their house, has to be background checked. Because we want to make sure that the residents are properly cared for and that there's nothing.
They're in a safe environment.
Right, that they're in a very safe environment.
Well, it just sounds like a win-win, just a wonderful program, and I'm so glad you could come on to talk about it and get the word out. We'll post some information at the end of the program with the website and the phone number again that they can call to get more information. And thank you again, Rhonda.
Thank you for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.